Step by step, we'll light the way.
My name is James Roberts. I'm a patient care coordinator with Find Help for Cancer. We're speaking with Dr. Lemmo, not only just a great doctor, so about 27 years worth of of practice, 25 of those with cancer patients. And I help, many people will know who Dr. Lemmo is, but with Find Help for Cancer, I simply have conversations with patients and help match them up with appropriate facilities, whether they're in Canada or Arizona or Mexico, seem to be very popular areas. I've enjoyed my conversations with Dr. Lemmo, and not only a great doctor, but a great researcher. So we're going to be talking about a subject today regarding breast cancer and chemotherapy, if that's necessary, and the study that was done. I think this was like 40,000 patients that the study was done, which is considered like a gold standard regarding that type of a study. So the doctor, introduce yourself, and I wanted to talk and ask some questions regarding the study. So thank you very much for your patience here as we were getting through some technical difficulties. So thank you.
Yep. No, thank you. It's a pleasure to have discussions with you, James, and so appreciate what you're trying to do and the work you're doing. So as James mentioned, my name is Dr. Walter Lemmo. I'm a naturopathic doctor who's been in practice for over 27 years and in seeing oncology patients for the majority of my career, over 20 years. And, I always do my best. I've been more trying to educate more people on just all this new information and research that's out there, and which is where James has been talking about. So the study that James is referring to, so there were some recent headlines, I'm sure some might have seen, where it says, millions of women could not need chemotherapy, which is a pretty profound statement to make. And just to clarify a bit, when you said 40,000, it was actually 4,000.
4,000.
Yeah, 4,000. But just
thank you. That's a little bit different. 4,000 is still a lot. 4,000 is still a lot.
Yeah, but still significant,
Yes.
And so it was actually from the UK, but it was a multi-country trial, and so in particular, what it dealt with was the groups of women with breast cancer that are hormone positive. So that would say that's the vast majority of them. Like probably over close to 80% of them. So it's hormone positive HER2 negative. So that's just the classification. So they're just strictly hormone positive, meaning estrogen, progesterone positive, like either one of those or both. And so it's not, say, triple negative or others. But and the issue with chemotherapy, why these kinds of tests this study was important, is because specialists have always known that chemotherapy has largely been over treatment. So meaning it's like they were giving chemotherapy to, say, 100 women, knowing that it's a smaller group that's going to benefit from them. And so the classic questions have always been is, how do you pick them out?
Right.
And there have been tests. So in this study, they actually were using this genetic test called Prosigna, which looks at 50 genes. So it's actually looking at the tumor sample and analyzing it. And there's been some other competitor products called, Oncotype is one popular in North America. There's one called the MammaPrint that's been more popular in Europe. And these are commonly used as well in breast cancer to pick out groups as well that are more responsive. But what's a bit more unique with this study is that these women were, say, over 40 years of age, but they were also included women that were considered higher risk. And so by higher risk, what I mean is, like, say, when you're seeing, say, your oncologist, your healthcare team, they're kind of stratifying people out into risk calculations. So say if a tumor is large, that's say a risk factor. If there's like multiple positive nodes, say greater than 3, or in this study I think they went up to 9 lymph nodes, those are risk factors. So sometimes just based on those calculations, a judgment call is made to give chemotherapy just because
Right.
of risk calculation. And so what was really unique about this study in particular is they took those groups and they said, okay, let's run the genetic test on them, on all of them. And the ones that were considered like lower risk based on a score, we're not going to give them chemotherapy, and a group of them, and then obviously the other groups, they could receive chemotherapy, and then with the ones that were higher score, that those ones were like, okay, those are more automatic, the chemotherapy. So anyways, then they tracked these people over 5 years.
Okay.
And so this was the interesting part, is that when they looked at 5 years, just based on the ones that were lower score, so they could be higher risk based on, tumor size and lymph nodes, but they just said, no, we're just using this genetic test, the Prosigna, on their score, their individual genetic analysis. And they found that 2/3 of these women, like in these lower score groups, so in these lower score groups, they did not need chemotherapy. So when you compare their 5 years, it was almost identical. So I think they were, so basically the group that received no chemotherapy, at 5 years, they were like 93.7% survival,
Right.
versus the one that received the chemotherapy was like 94.9. So it's like literally like a percentage point, right? Like a
Negligible.
point. So it was like almost identical, right? So like and then the group that obviously were the higher score, like which were 1/3 of the group, they're the ones that had this value with the chemotherapy. So imagine you have these women that were considered higher risk, and then they do the genetic analysis, and so they find that 2/3 of them were actually lower risk on the genetic analysis.
Right.
And then you compare the groups with and without chemotherapy, and it was like a millimeter off.
Right. And then,
So that was like huge news. And
this is life-changing, because so many patients that I'm speaking with, that's just a big struggle. I mean, the reason they're calling me is that they don't want the chemotherapy, right? They've had family members that went through it, or they know of someone, or they've done their own research, and they're like, all the horrible potential side effects, and they're trying to avoid that. And to see a study like this that was done over that period of time, to come up with these results, this is, potentially just, life-changing events for people.
Absolutely. So imagine, like, say, there's like, and what was shocking about the study was how big the group was.
Right.
So, again, these were ones that are considered higher risk, and yet in that higher risk, 2/3 of them, like, had that, like, oh, looks like there's barely like no value to chemotherapy, in that group. And so that was really fascinating about this trial, and that really was a bit of a game changer. So, like, and I'm sure, like, you have run into this, like me, where these groups of women, they just feel, I don't think chemotherapy is for me,
Right.
and so, and then you have these specialists where they're a bit handcuffed, they're a bit stuck, in that world and legal responsibility, and where they're probably recommending things because they have to,
Right.
and then yet studies like this come out now to say, look how big this group is, and
Right.
it was, so it's a really interesting study, and And there's been like looking at this with other genetic tests like the MammaPrint as well, but this is something that's like I don't know if you can exactly compare these tests with the other ones with this group like this, but it's this is like unique more to this Prosigna test, but anyways, I think it's a really fascinating game changer, and as you rightfully mentioned, like chemotherapy otherwise, like as what's the difference between chemotherapy being a poison versus a medicine is if it works or not. You know what I mean?
Right, right,
So if it doesn't work, it's a poison. You're being poisoned, right? And
right.
if it works, it's a medicine. So imagine these big chunk of women were being poisoned, versus the other group, the 1/3, it was a medicine, and
Right.
so it's really fascinating. And as you said, like, chemo otherwise doesn't give you superpowers,
Right,
and
right.
it's
No, where do patients go to get the test done? Because I could imagine that maybe the doctor that's giving them their diagnosis may not be testing them for this. Where can they go to get these types of tests?
yeah, like these tests, like they are available like with the laboratories, right? Like, so in essence you get the kit sent over, and
Oh, okay.
and then and they need to look at the tissue samples, right, that are say formalin fixed, and then away you go, right?
Okay.
You fire them off, right? So sometimes, like, so obviously it depends where people are, like, so for example, me being in Canada where it's more socialized medicine, there isn't always a lot of choice on like all these types of kits available. So say here in British Columbia, it's more being like it's the competitor test, the Oncotype, that's more, I guess, more commonly used in this group. And so a test like this one it's to my knowledge, it's not really available, and
Right.
so imagine, like, in other places, like where there's insurance coverage or not, like, say if there's insurance coverage, that would be a covered test, right? And
Okay.
so it's something that it's available, and and I'm sure the company would love your business, to get these things done,
Right. And then what a potential, life-changing event this could be, and taking the, what is a scary diagnosis, and offering more hope and help out there, so that the patients don't have to go through that.
That's correct. Like, yeah, like as like the chemotherapy options that are used in breast cancer, they're not gentle. They're hard.
Right.
And so and then obviously, as like, besides, yes, the side effects that you can get with nausea, vomiting, and nerve muscle issues, but some of these side effects could be long term, and some of them could be long lasting.
Right.
And so some people could be forever changed.
Right.
And so imagine that, right, where you have this capability in this group of hormone-positive breast cancers, where you could be like teasing out these groups and minimizing and stopping this potential other issue for them, side effect from the treatment. So it's a real interesting, like, time. And as I said, like, there are other tests that do also look at this, like the Oncotype test, the MammaPrint, that also look at this as well, and it are being used. But as I said, and like, what's also interesting in this study, like, some of these women had up to 9 positive lymph nodes, and
Wow.
which are considered more higher risk.
Right.
And so that's what I think makes this study also quite interesting, on such a bigger group.
So even with the lymph node involvement, they could still be avoiding chemotherapy.
That's correct.
Wow.
And that's what I mean. That's what's amazing about this study, is that it's not necessarily just based on some that are like considered lower risk. These are
Right.
higher risk, greater than 3 centimeter size, tumors. And so it's stuff like that, which is, it is a bigger deal. And I think that's why it's been getting some of the attention that it deserves. And I think what you're doing in this area is amazing in creating that level of awareness. So
Correct. And because you're a standard of care, sometimes it's not avoided, but there are other options. You don't have to just you don't have to just throw in the towel, right? And not as a boxing term, just give up like that, right? There's simply other options, and maybe for you, as the patient, this could be avoided, entirely. So and what a blessing, that would be, that health burden and mental burden is relieved for the patient, that they don't have to do that.
That's exactly right. And then you do, when you mention like the subject of standard of care, so obviously the study also assumes that the other indicated levels of care of treatment are indicated. So say, for example, in hormone-positive breast cancers, there's usually like endocrine treatment or hormone targeting treatment.
Okay.
So just to kind of, to mention that. So the assumptions is that while, say, chemotherapy, part of it was not looked to be as valuable in these lower risk groups with the test, it's still, though, assumed that they were doing the other treatments.
Right. Okay.
For what it's worth, right? Like, obviously, like anything, we, I'm sure we know, like, yeah, probably in subgroups, like maybe radiation, like how well does it work for them, and then and same with hormone treatment. And so, but unfortunately, I don't know if there are tests yet to like stratify those groups out even further.
Right. Well, those will be coming as technology comes out. But this alone is a huge, big deal, that patients could avoid that. That's correct. And,
yeah.
That nightmare doesn't have to be you, right? There's simply other options that are available, and I'm happy to point you in the right direction, with other options and doctors that would fit the specific needs. But when you told me about this study, I went, really? There was actually a study done on this, that somebody could actually avoid, all of that, that harsh treatment. And because I get to hear all those horror stories and negatives over the chemotherapy, so that somebody could potentially avoid all of that would be just life-changing.
Yeah, and I think what they can also focus on as well, so for us being more in the integrative landscape, what other things can they maybe focus on,
Right.
in those window, right? So imagine these women, largely, they say say a lot of them, they probably had a surgery, and they're trying to heal from the surgery, and all of a sudden chemo is introduced.
Right.
And so imagine what that can also potentially, when you think about it, it's like, okay, it's like you could really then focus on supporting these people, even with all these modalities and tools and approaches, while that is okay, not maybe a focus in this group, it's well, let's really focus on healing you,
Right.
and make you, to make you recover well, not only physically, but mentally, psychologically as well. So it opens this other area, because, as sometimes when chemotherapy is always brought up, the more standard of care, tends to recommend, don't mix too many things, with treatment. And that tends to be a recommendation you tend to hear about.
Right.
That doesn't mean I totally agree with that, but anyways, I think there's creative ways of doing things, but again, that kind of removes that variable, and
Right.
you know what
Right.
I mean? That's
Right.
off and then you could really be focusing on all these approaches to really help people to post-operatively heal, try to focus on their immune system and other factors, and so that, who knows, like maybe those things could be adding those other kinds of percentage points, down the road, right?
Correct. So this was just great news, and I appreciate you sharing this study and offering some more hope and help out there that when you're given a diagnosis, it doesn't have to be only one option, right? It doesn't have to be just one option. So the testing coming in could be, I see this as life-changing for so many people, and opening so many other options to their care and get their lives and their health back.
Absolutely.
Wonderful. Well, doctor, it's been great speaking with you. I look forward to future conversations, and just such great insights. So most appreciative, and thank you very much for joining me here today.
You're very welcome, and thank you for sharing this news, to all people.
My pleasure, and look forward to future conversations with you. Thank you very much.
Okay, all the
yes,
best.
Sir. Thank you. Bye-bye. God bless.
Same to you.
I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.